All right. Hello, everybody. I'm Brian, and this is AAMI News and Conversation. I'm here today with a very special guest, one of our AAMI Award winners who we weren't able to catch up with at AAMI Exchange 2024 this year. So we've been able to get him on the horn. This is the AAMI Foundation and ACCE Robert L. Morris Humanitarian Award winner. These are the award winners who I really love speaking to because the work they do is always very inspiring, and they always have very impressive stories. So I'm so glad that we get to talk to Clement today. But without any further ado, Clement, please introduce yourself. Tell us who you are, what you do, and where you are.
So thank you very much, Mr. Stallard. My name is Clement Appiah. I'm a biomedical engineer. I'm actually serving as a clinical engineer, senior clinical engineer manager for Ghana Health Service in the Upper East Regional Hospital. I took leave from work as of now. Currently, I've taken leave from work to pursue my master's degree in biomedical engineering. So that's it.
Oh, that's very cool. And where are you currently studying for biomedical engineering?
University of Ghana.
Very cool. All right. So, and for those who don't know, the L. Morris Humanitarian Award every year, this is really given to those folks who, within the clinical engineering or healthcare technology management field, really go above and beyond, set a ton of their time aside to help out humanitarian projects, nonprofits, NGOs, things of that nature. And Clement's background, we were talking about it a little bit before we started recording, but you have basically sacrificed what I would call a significant amount of vacation time to instead spend it on humanitarian pursuits. So let's dig into a couple of those. Can you tell me which projects you've been involved in recently? I know you mentioned Ghana Medical Help, for instance, is something that is ongoing all the time. So why don't you start with that one?
So I was posted to the in Ghana service. I was posted to the deprived region of the country to serve there, and because of that, we do have agents coming in to help or support our cause. And Ghana Medical Help is one of them. Ghana Medical Help used to still do supplies with medical equipment, and then give us sessions of capacity building. So over that period of time, we established strong relations, and then we decided to embark on small projects, one of which is visiting hospitals that do not have clinical engineers to support them with our services. And then others is to organize trainings for newer engineers that are recruited into the system.
So Clement, and you know what, a lot of the humanitarians we've spoken to in the past, when they talk about areas that are deprived of resources, a lot of the time they're talking about being deprived of medical devices themselves, right? Or devices that are suitable for that area. But it sounds like to me what you're talking about is they're deprived of talent. They're deprived of people with the right education. So you come in and you help educate folks. Is that right?
It's both. There is deficit in capacity. Even as at now that I've left my place for school, I'm not happy because there is a gap there. Okay, so there is a need for more in terms of capacity, and then also medical equipment too as well. So it's both.
I see. So where would you like to see things start? Is it more so in the education side of things? Do you think Ghana needs to step up with education?
Yes, I think there are avenues. They are organizing something, but I think it can be improved, or we could put more let's say help or more efforts into it.
Mm-hmm. And you yourself, you have experience as a teacher, not just with medical help, but you also taught at GIAU International Christian Academy and Woolley International School. Why don't you tell me a little bit about that? What got you involved teaching?
Okay, so this is what happened when I finished my first degree. So
Mm-hmm.
after first degree, I didn't want to stay at home doing nothing. I wasn't employed at that time, but I didn't want to be idle. So I decided to teach. So that's how come I got employed into Willie International School and then GIE. I was teaching ICT and I believe general science in the at yeah, I think it's ICT and general science. Yeah.
Excellent. Why don't you help our viewers kind of better know you? Is teaching something that you have a passion for? Is it more the technical work?
So it's both. You know, the thing is, if you install a medical equipment, you have to teach a nurse how to use it. So
Mm.
it works there. If you love to explain and get people to understand things, uh, my passion is in the technical side, but I also love to teach too as well. And in the hospital, you do both. You in fact you overdo it because the nurses, when you teach one, they don't tell the others. So you have to do it again. You have to keep doing it until everybody gets to
Ah.
understand it. So you keep teaching, you keep um uh what do you call it? You keep reminding them of how to do stuff. So my experience in teaching is being well, I'm still using it here in the hospital as well.
That's fantastic. And you know what, it's interesting too, because a lot of the older clinical engineers or healthcare technology managers here in the United States might not always think that their job is going to be about teaching or interacting with anybody else around them. A lot of these guys, they'll sit in the basement, they'll repair the devices, and then that's it. They don't really do much else. Why do you think it's different in Ghana? What's going on over there that needs teaching so importantly?
So so I think it's not in only in Ghana. I think
Yeah.
our our course is to prevent if the problem even before it happens. So we are supposed to get people to understand how to use the medical equipment. You know that medical equipment, what do you call it? Downtime is more of like due to um, user error than for the machine itself to break down.
Uh,
So if you're able to train the users very well on how to use the medical equipment, the lifespan of the medical equipment will improve as to waiting for the equipment to break down before you do the corrective maintenance. So teaching is a preventive way of doing our work.
no, I love to hear it. And you know that's that emphasis on soft skills that a lot of the time Amy talks about. So we love to see it in leaders like you. I also I know we mentioned Mercy Ships and also Operation Smiles, two of the other programs that you were doing. So I did want to talk about them briefly. Why don't you tell me a little bit about Mercy Ships first? Because I know you took a significant amount of leave to work with them recently.
Yes, mentorships is a true eye opener for me because, like I said, I worked in the most some of the deprived areas in my country, and usually you don't see test equipment like sophisticated test equipment. So it was at mentorship that I got to work with um, several test equipments, like the what do you call it, the electrical safety analyzer, the defibrillator analyzer, the several analyzers, and then several sophisticated equipment that are used to uh, check or verify the 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 parameters that the medical equipment is supposed to give. Okay, you have to
Mhm.
be sure that the equipment is giving you accurate readings before you put it on a patient. That is where I really got to appreciate it. So I was saying that my experience with mentorship is always valuable to me because that's where I got exposed to test equipment. Okay.
You said, yeah, you decided to take that time for Mercy Ships, because you thought you would be able to learn a lot. What were some of the takeaways from learning from them? What were you able to bring back to your day to day?
So mentorships, when it comes to meeting standards, make like meeting world standards, they do their preventive maintenance. They have a CMMS that they has a record, like inventory of all medical equipment. And then when there is a problem with the medical equipment, we have job cards coming in So we are able to respond, and when we respond, we take records. We're able to insert it into the system, so that if I'm not around and somebody else is coming, the person can just continue work, because the system is such that you can be able to read, know the history of, or know what it was happening before you came in. So over the workflow was very smooth. And then everything, the workshop has everything that you need to repair an equipment. The workshop has everything you need to check to verify the performance of an equipment. So it was like the heaven of biomedical engineering. Everything.
And you were able to take a lot of that process and apply it back in other places to help improve the efficiency elsewhere.
So now my focus has first, I was so excited when I get medical equipment repaired. You know, when I'm able to repair medical equipment, I feel like, yeah, I'm in heaven. But now I have learned that you have to, after the repairs, you have to ensure that it is safe for the patient. That is the extra that I've learned. So after repairing, after getting the equipment to function, you are not done. You are supposed to make sure that all the parameters that the equipment is given is within a safe range. So that is what mentorship has given me. That detailed work. Okay. And then how to manage equipment, how to anticipate risks and be able to mitigate them. You know, as you're using a medical equipment, what would you need? You don't wait till you have nothing before you request for resources. Everything is planned. It's like is just perfect over there. And that is what I learned. I learned that over here we have problem with the resources to acquire. Okay, but there is the money to acquire spare parts and everything is there. So you do everything on time, and that is a perfect system. So what I've learned is if I get opportunity to educate people, I let them know what I've learned from there. I let them know that we are not all about repairing, but we're also about ensuring that the patient that is on the machine is also safe. If you are done with repairs, you are not done. You have to verify that the output that the equipment is giving is within a safe range. So
oh, beautiful. And I like that you brought it almost full circle back to us talking about the importance of conveying information and instructing those around you. And information sharing seems to be so powerful, even in areas like where you are, where it seems that not everybody shares the same ideas about the best practices for HTM. Is that about right?
Yeah, I think they have the education, but there's a difference between knowing and then actually practicing. And that is where I want to come in. I want to be the one to spearhead, you know, our new leaders in the HTM to think about applying what they have actually learned from school, and not barely knowing it and then keeping it to them and then complaining that the managers or the other managers are not supporting them. Okay.
No, that's fantastic to hear. And Clement, I'm looking forward to hearing, you know, the next path in your career, how you can go about applying that and really helping lead the way where you are. I'm gonna wrap this up here since we're coming up on time, but I wanted to ask you, is there anything else you wanted to share with the AAMI community? Any takeaways on your end? Maybe how might they get involved in humanitarian efforts wherever they may be?
So there's a lot of room for AAMI to help. You know, there are a lot of very enthusiastic youth out there. Even as of now in the universities, we have a lot of smart guys out there. The only problem is, you know, the lack of resources is such that when you know the standards, you know what to do, you get frustrated. It's some of us would like to fight, some of us will not relent, we want to go and learn more and even come and apply. But usually what happens is they lose their passion in a way, and then perhaps they look elsewhere. They look elsewhere. But there are very vibrant youth avenues that they help, especially in training of upcoming engineers, providing them with the tools that they need, especially the test tools. We don't have it here, the test equipment. So usually, what happens is when you are done with repairs, then straight the equipment gets to the patient. We don't even check to see the values or the parameters. So if there is help, then I think the help should be in, I don't know, if we have about 16 regions in my country. If every region has even a very good workshop that has all the test equipment there, and some of us are learning and training regional engineers to know how to perform it. And I think that they can also come together as a group and then go to hospitals to check the safety and then verify the safety of medical equipment in my country.
Oh, it's a fantastic idea, and I'd love to see it happen. So we'll stay on top of this, and obviously Amy will see what we can do to help out as well. We'll stay in touch, of course. And Clement, thanks again for joining me today to talk about this, and congratulations on winning the award. It was well deserved. It's the AAMI Foundation and ACCE Robert L. Morris Humanitarian Award. Congratulations.
My message is I'm so grateful. In fact, I cannot tell how much I'm grateful to them. It's only God who knows why I'm saying this, but I'm I'm extremely grateful to them. Yeah.
Oh, thank you so much. It was good talking to you today, and I think that's a wrap.
Thank you so much. Thank you.